We're just gonna get straight to it. I'm gonna tell you 5 moments that I've had in my nursing career that made me realize that, wow, going into nursing was so worth it. Hey everyone, my name is Whitney. I'm a registered nurse, and you're watching Nurse Life Wit, where we talk about all things nursing, life, and walking with Christ. So moment number 1 was actually a case where I had this patient who, when I first walked in, were a big meanie to me. They were being so not nice, so sarcastic, so rude, and I'm just like, bro, I just met you. Why are you being mean to me? For me though, when it comes to patients in the hospital, the way I like to think of it is patients can literally be going through some of the lowest, most vulnerable moments of their life, dealing with getting their toes chopped off, missing their granddaughter's graduation, new diagnosis. They might not be able to play golf anymore, things that are really important to them in their lives. At the same time, while having to ask to go to the bathroom, not being able to sometimes wipe their own bottom. Like, a lot of times people are being stripped of their independence and their regular lives as they know it, and they can be in a really low place. So sometimes people deal with that differently. So I really just try to take that into consideration when I am dealing with my patients and not immediately get defensive if someone is a little bit more irritable than, you might like. Anyhow, so with this patient and with all these things considered, I decided to, as you should, treat them with kindness, love, compassion, all these things. Just walking in, is there anything else you need? Just checking on you, are you okay? All those types of things. And what really made this day special is that we started off real feisty in the day, but by the end of the shift, this patient was like, wow, thank you so much for taking care of me. I am so happy that you were my nurse today. And that really could have brought a tear to my eye to realize and see that your love, your compassion, and the work you did in this day was able to positively impact someone else. Really just made me feel like, wow, this is why you does this, bro. And that is a moment that I will always take with me and just hold near and dear to my nurse heart. Moment number 2 was also kind of similar, but not quite. But basically, now I work in a neuro ICU, so a lot of times I have stroke patients. And when it comes to having a stroke, they can be so devastating and debilitating. A lot of times strokes, they are survivable, but they have one of the highest rates of disability because literally a whole part of your brain is without blood and oxygen that it needs to function, and it can be damaged, and basically it's a life-altering event if it's not met with immediate intervention. Anyhow, so this patient, they had a mom and a daughter. Their dad was a completely different person from this morning when they were just fine to this evening when they've had this stroke. And the fact that their dad was laughing and joking and being themselves that morning, and now they're confused, don't know where they are, who they are, what's going on, they're a whole different person, that can be so scary and frightening, all that type of thing. So as I am caring for this patient, I'm just getting on, they just got transferred to our hospital. I am basically just explaining what's happening, what's going on, and we like to call it narrating our care. So I'm like, hey, I'm Whitney, I'm going to be the nurse tonight. And these are the things that I'm going to be doing for your dad throughout the evening. And just laying it out, talking to the patient, hey, I'm going to do this, I'm going to check your pupils, and basically just kind of setting the expectation for the night and walking them through. Literally before 10 o'clock p.m., they were just like, wow, we were going to stay here all night because we just didn't want to leave him alone. But the fact that I know you're going to be taking care of him, we feel comfortable enough that we're actually going to go home, shower, rest in our beds, and then we're going to come back and see him first thing in the morning. And for me, just the fact that the way I exhibited my care to this patient and their family made them feel comfortable enough to leave their father's life in my hands just felt so rewarding. Girl, that's why you do this. That's why you became a nurse. Anyways, the third moment that really made me value being a nurse and made it all worth it isn't actually a patient care story, but it's just related to the versatility of nursing in general. Anyhow, moment number 3 was when I came to a moment that I had to get out of my current position. So for the first 2.5 years of my career, I worked as a med-surg nurse, and med-surg is notorious for being a hot mess express at times, just in terms of you have one of the highest ratio of patients. Basically, at least in California, this is just in California where we have strict ratios, we have 5 patients to 1 nurse. And other places like Florida and other places out there, they can have 6, 7. I've heard some nurses tell me they had 8 patients, crazy numbers. But granted, although these patients may be less sick, not needing a ventilator or basal pressures like they do in the ICU, they can still be pretty darn sick and have lots of care they need. Wound care, blood sugar checks, multiple medications all throughout the day. It's still 8 people who need to eat, pee, poop, be cleaned up, ambulate, have hygiene. So it is so busy. And at this point in time, also, you could watch a whole another video I have talking just about med-surg nursing, how busy it is, especially during the day shift. So at this point in time, I was a day shift med-surg nurse where everybody and their mamas in the hospital needing you, calling you, not just the patients, but like family, the interdisciplinary team, OR is calling, the SNF is calling, all these things, discharge. Anyways, I realized I cannot spend the rest of my nursing career like this. I was walking around all day with a heart rate of 120. I was like, this cannot be healthy. So the great thing about nursing is that when some people are burnt out in their career, they like to change careers completely. And as a nurse, you can essentially change your career all while being inside of your career just by switching specialties. So with your nursing degree, you don't have to just be a med-surg nurse. You can be a labor and delivery nurse, OR nurse, outpatient nurse in the post-anesthesia care unit. You could eventually, ultimately find an area of nursing that suits you better. And for me, at that point in time, when I was just completely at my wit's end when it came to med-surg nursing, I was able to apply for a specialty training program to become an ICU nurse. And that, Lord, thank you. That was the best decision I ever made in my nursing career, aside from becoming a nurse. Granted though, med-surg, I learned so much. But at this point in time, the ability to switch to ICU nursing was amazing. Being able to have 2 patients, even though they are sicker, vitals every hour and your inputs and outputs every hour. Sometimes you have like hourly neuro checks. Some patients you actually have to assess every 15 minutes for different reasons, brain drains. Even with that, I will take all that going on with 2 patients rather than my less sick 5 patients any day of the week, twice on Sunday. And I feel like it just really suits me. The ability to spend so much more time with my patients. There's just so many reasons why I love being an ICU nurse and why I'm so happy that in my nursing career, you're able to make those switches as you desire, as long as the position is available. So that was moment or situation number 3. Moment number 4 kind of relates to moment number 3 because with having now 2 patients in the ICU, I'm able to spend so much more time with my patients. Granted, you still do have busy days in the ICU where you might not be able to give that patient a bed bath because you got a patient that's been crashing. You know, things like that. Like, of course, you're going to prioritize, but all in all, I essentially feel like I have a lot more time with my patients. I love that because I love being able to give like that care that I've always wanted to give that I couldn't always give in med-surg. Anyway, so on this particular day, I had a patient who could use a little bit of TLC when it came to like different measures of hygiene, you know? Anyways, with that being said, I introduced myself to the patient's family member. I say, hey, my name is Whitney. I'm gonna be your dad's nurse today. I'm gonna go ahead and get his temperature. We're gonna assess him. And you know what? We're gonna get him nice and clean and comfortable. And I'm kind of just like walking through, explaining what I'm doing. So I'm doing the oral care. I'm explaining to her how killing the germs at the source, preventing the bacteria from harboring in their mouth and going down the airway and causing pneumonia. Every couple hours, I'll be doing this, keep his mouth clean throughout the night. I'm explaining also, so when I do his bath tonight, I'm also going to go ahead and use these wipes right here. It's basically an antimicrobial. It'll help attack any germs that's on his skin so it's not sticking around, crawling into his catheter or crawling into his central line. And one thing we really like to do is keep patients' skin moisturized. Patients, when their skin is dry and flaky, it can be more susceptible to breakdown. So we'll go ahead and make sure we keep it moisturized, especially his pressure points and his heels, all that type of thing. And basically just walking through how I'll be caring for him from head to toe as I'm doing it and all type of thing. And with that, being able to like care for this patient in the way that I desire to, it was really great because literally after all that, even though it was like a lot that needed to be done for this patient, what really made it feel so good and so rewarding is that at the end of all that, this patient's family member was just like, wow, I can really tell that you love your job. Like, I can tell that you are meant to be a nurse. And I was just like, wow, yeah, I do. And it's kind of just further confirmation of like, girl, you made the right choice. Like, nursing is your jam, girl. Like, that's your jam. Anyways, last but not least, one more moment that really made me realize that nursing was so worth it wasn't actually a patient care moment, but a life moment. Basically, at this point in my life, I was so sad. This is when I was working in med-surg. I was super stressed out from work. I was so sad about this breakup. And I was just constantly in this space of like, either I was at work being stressed out about being at work, or at home just being happy that I'm not at work, and then stressing out about going to work. And it was just this constant cycle. I wasn't really happy, and I realized like, I need a break. I need to step back. I just need to regather, figure out my life. And with being a nurse, there's so many, not just versatile specialties, but versatile schedules as well. and I was able to switch my schedule into a per diem schedule and still be employed by my hospital and now work when I decided I wanted to work. I just had to work like 4 shifts a month if I wanted to. And at this time, I was still living with my parents, so didn't really have to worry about the mortgage or nothing like that. But overall, it really allowed me the time to just take a step back and focus on myself, focus on things that made me happy. I was able to like call up my brothers and be like, hey, I'm about to make my schedule for the month. Do you need me to babysit? Or which days? Like, oh, I can see my nieces on this day, that day, that. Yeah, absolutely. Like, you know, that type of thing. It really allowed me to spend more time with my family. We had a family vacation and I was like, oh yeah, don't worry, I'm gonna be there. I'm not gonna miss it because guess what? I'm gonna just not schedule myself for those days. So it was really cool to be able to have that freedom and the ability to just like hop out and take a step back real quick, because not all jobs have the ability to just go from what, like 40 hours a week to 12 hours a week, or you know, something like that. So for me in that time, that was such a valuable aspect of nursing that I really appreciated and made me feel like, dang girl, I'm so glad I decided to be a nurse. Because later when I was better again, and also when my budget was hurting a little bit more, I just jumped back into a full-time position. Anyhow, that pretty much sums up the 5 moments that made me realize nursing was so worth it. I'm sure there's a myriad more reasons. Those are just the first 5 that came to my mind. But thank you so much for watching. If you enjoyed the video, please leave a like. And if you would like to hear more, go ahead and subscribe. Thanks again for watching, and I will see you in the next one. Peace.